Hi, I'm Carissa. Over the next few weeks, we're going to be having a whole range of conversations with our staff and giving you a behind the scenes look at how we're helping care for our communities. We know that there's a lot of sickness going around this winter, so for our first video, we're joined by Sally Havers from the Infection Prevention and Control team. Sally, thanks for joining us.
No problem.
Can you tell us a little bit about the work that you do at Darling Downs Health?
Okay, so I am the CNC for Infection Prevention and Control, which means I look after the team of infection control practitioners that work across Darling Downs. Our job is really looking at infections and what we call significant organisms, but basically bugs across Darling Downs that our patients might come across in their care or in their day-to-day, and how we stop transmission of those across the health services or to other patients. So before COVID, our biggest job was looking at, people might be familiar with antibiotic resistance. So antibiotics organisms that aren't able to be treated with certain antibiotics. We looked at those to try and reduce the spread of those across our health service and prevent, obviously, any further transmission of those or of those affecting our patients. But COVID has obviously changed things a lot for us. So on top of that work, which we do already still do, we then had to really change what we were doing and add to that and look at how we stop the spread of COVID in our hospitals, but also in our aged care facilities and our multipurpose health services, so that we kept our patients safe basically during this pandemic, and particularly because our patients and our residents can be quite vulnerable to COVID if they happen to come across it. So that's in a nutshell what my team do every day.
Sally, the Darling Downs Health region is quite large. How does your team look after that footprint there?
Well, I like to say we're a small but mighty team. We have staff placed all over. So we have someone who's in Gundawindi Hospital, for example. She's there every day. We also have a staff member who looks after all the way out to Taroom. So every single hospital is checked every single day. So we have staff that cover across, not in every site every day, but we check those results every day. And we have staff that are on site at least, quite regularly, at least every couple of weeks, to check in on everyone. So it's a broad area, but we like covering everywhere and giving that support. And it's really great for us because we learn all about the different sites and how to best support their staff in managing these infections in what can be really different locations or really remote locations.
Yeah, absolutely. And you mentioned COVID. How challenging has this winter been, because we've had COVID and the flu as well?
It has been incredibly challenging. Obviously, the last few years of COVID, we didn't have the flu that we've had this winter, and we also had a very early starting flu season this year. So it is really challenging for us and for the health services to manage that, because just sort of to get a bit technical, but when we isolate people who have got a particular organism, you can imagine we're already trying to isolate and keep our COVID patients safe, but then we also have flu now as well, and we have to isolate those patients. And then some patients are even unlucky enough to get flu and COVID at the same time. And so those people have to be isolated separately again. So all of a sudden we've got 3 groups of people that we're trying to manage and keep safe and look after. And then those people around them that we don't want, obviously, to get any of those things. So it's been really challenging to manage that. And it's obviously really challenging for our frontline staff to look after patients, wearing the PPE all the time, changing and those sorts of things. So yeah, it has been really challenging time for the team, but also for our frontline staff and our patients who are affected by that as well.
Yeah, absolutely. And I guess it's important to remember that while we're seeing some restrictions ease in the community, like you no longer have to wear a mask in an airport, they still remain in the hospital. Can you tell us what Darling Downs Health is doing to keep our community safe?
Yeah, so it's actually in some ways it's harder for us now because we feel like we're asking people to do something really different to what's in the community, and that can be really confusing. Like, why don't you have to wear a mask? But then you have to come here. the thing is that we still have our staff in really high level PPE, depending on how much COVID is out and about in the community. So that it doesn't change those sorts of things for us as from staff perspective. So when people come in, they'll see people who are still in high level PPE. But the biggest thing is we're still asking our visitors to always wear a mask, because it's the most effective way for them to protect whoever they're visiting, whoever they might come across in their travels, but also our staff, because we don't want any of our staff or any more of our staff getting sick, and we want to protect them as well. So it's really important that people wear their masks when they come in to visit. The other things that we do is my staff check results every single day. So every single person who has a test done at Darling Downs Health, my staff check their results and make sure that they're in the right place, that they're being cared for in the right place, that they're if they're in the hospitals, no matter which hospital they're in, that the staff know that of their test result and what they need to do to effectively care for them and isolate them and keep them and the other patients safe. So there's a lot of work that goes into that, but it's important to us to stop that risk of transmission across DDH or outside of DDH, where our patients sometimes go as well.
And you touched on it before, but people might not realise, or they might not think about the fact that our staff aren't immune to COVID or the flu either.
No.
So these are some simple steps we're asking the public to take to help protect themselves as well as our staff.
Yes, definitely. So our staff are not immune, and our staff do work shift work as well, obviously, so that often makes you more tired and those sorts of things, so you can be more susceptible. And the flu season is particularly bad this year, in that people who are getting the flu are getting a little more unwell with that. So our staff definitely aren't immune, and that's why we do ask that people wear their masks when they come in, and if they're sick, don't come to the hospital to visit. Obviously, if you have to come to the hospital for healthcare, that's a different thing. Wear your mask, maybe let the people know that you're feeling a bit unwell when you get there, so that everyone knows that that's going on. But if you're feeling unwell and you're coming to visit someone, the best thing to do is just to stay at home. It's the best thing for your loved one too.
Yeah, wonderful. Well, thank you very much for your time, and thank you to your team for all of their efforts at the moment. If you have any other topics, ideas or questions that you'd like us to cover, be sure to let us know in the comments, and we'll see you soon.